So one of the inspirations for this evening comes from the life and work of a very special man who's from your community. And I know he had a special role in the lives of many of you here tonight. So I met Dr. Mark when he joined our GP facilitator team at the Black Dog Institute. For those of you who aren't familiar with the Black Dog Institute, so we're a centre for research, education and treatment of mood disorders, so primarily depression and bipolar disorder. And we're located in the grounds of Prince of Wales Hospital in Sydney. My role at the Black Dog Institute is I develop education for health professionals. So it's education to teach them how to better recognise and manage depression and mood disorders in their practices. Although we had our beginnings in New South Wales, we now deliver education across the country, both in urban and rural settings. So that's where Mark came in. He joined our facilitator team to deliver health professional training, both in your state and beyond, which he did with enthusiasm, passion and diligence. I remember the day we interviewed Mark for the role. My colleague and myself had been on the phone for several hours interviewing candidates from all over Australia. And when Mark came onto the phone, within minutes we knew we had our man. His warmth, integrity and passion for the work was clearly palpable straight away. And so we invited Mark to come up and train with us. His immediate response was, "Will I have to wear my long pants?" Wherever Mark went, people quickly warmed to his open, friendly and unassuming way. And his workshops were always seen as the kind of valuable learning you can only get when it's delivered by someone who has true experience and understanding of the material they're delivering and of the messages that he hoped to impart. All of our team at Black Dog join you in your sorrow at the loss of Mark, and also in our determination to carry on his work and to carry on his message. Mental health issues affect all of us in some way. 45% of Australians will experience mental illness at some stage in their lifetime. That's very common. You're as likely to get married in your lifetime as you are to develop a mental illness. Not that I'm suggesting a connection between the two. Mental illness affects people of all walks of life, regardless of their gender, ethnicity, level of education, or their socio-economic status. Of the mental health disorders, depression is one of the most common. At any one time, in any one year, 1 million Australians will be experiencing an episode of depression. Anxiety disorders, which are the close cousins of depression, are equally as common, and the two have an unhelpful tendency to move together and to co-occur at the same time, which in medical jargon we call comorbid depression and anxiety. One of the things that has changed considerably during my career in medicine, so when I'm not working for the Black Dog Institute, I'm a general practitioner working in the northern beaches of Sydney. One of the things that have really changed is now the merging of physical and mental health into an overall concept of health. So we see physical well-being and mental well-being going hand in hand rather than being artificially separated. That means as doctors, we're not just tending to people's physical well-being, we're also looking after their emotional well-being and endeavouring to address these seamlessly in our day-to-day practice. However, despite this shift within our profession, more generally in the wider community, in people's mind, a kind of divide still exists. It's okay to seek help if you have asthma, if you have diabetes, but it feels like it's not okay to admit like you have low mood or you're experiencing anxiety. Whereas people rarely blame themselves for having physical illness, we still see people judging themselves as weak or failing in some way if their mental wellness is flagging. People don't feel ashamed for taking medication for their high blood pressure, even if they do find it a bit annoying. But they do feel ashamed of taking antidepressants and will often keep this secret from others. This needs to change. Bringing mental health into the broader concept of health is still a work in progress, and evenings like this evening tonight are an example of that progress. We can all be lured by the appeal of the tough, self-reliant, she'll-be-right persona of rural Australia. And while that persona can bring with it perseverance and endurance, it can also lead to isolation. It can lead to reluctance to seek help and a sense of failure if you can't do it alone. I hope one of our messages tonight is that it's very hard to go it alone when mental health issues arise. And even more importantly, you don't need to do it alone. The pain of mental illness is real. You'll be hearing tonight from people with lived experience, and they will help to convey this more fully. Some of the people I care for in my practice tell me, I'd rather have 2 broken legs. That way people can see where my pain is and understand it more fully. It's hard for people who have never experienced it to imagine how hard it is to battle day after day with a mind that is telling you you're no good, your life is no good, and things will never change. The heaviness and sometimes the numbness of carrying low mood can at times be overwhelming. Our logo, the Black Dog logo, which you may have seen, comes from Winston Churchill. You may know that Winston Churchill suffered from depression quite severely. In fact, it's thought he had bipolar disorder. And he used to call his depression the Black Dog. And so our Black Dog sign has the face of a black dog, but it also has a victory sign in it for victory in our quest to conquer mental illness and depression. So admitting to yourself that something's not right is often the starting point, and seeking help is often the turning point from which recovery can begin. We've still got a lot to find out about the brain and about what changes in the brain when mental health issues arise. Research are continuing to explore numerous leads about the underlying mechanisms that cause a genetic vulnerability to translate into the emergence of depression and anxiety and other illnesses. But we have come a long way, and our understanding of what causes mood disorders and what can help people recover is continually expanding. So what does treating mood disorders look like now in the 2010s? Firstly, it's a person-centred approach. What does that mean? It means that every person is unique and comes in a unique context, factors within which their depression has arisen. So although there are common principles that we can apply, understanding people's past, their family background, their social setting and their circumstances and the form of depression that they have is fundamental to our management planning. Secondly, collaboration. When I was a junior doctor, people used to come to hospital with a bag of pills and say to me, I used to ask them what are they for, and they didn't know. They said, I don't know, the doctor told me to take these. And when I asked them what surgery they needed, they didn't know. They just said the doctor needed, I had to have an operation. It's no longer like that. Now we're in an age where we can talk together and make informed decisions together. So that collaboration is about negotiating treatment together. The modern doctor-patient relationship is a partnership where treatment decision is shared. Thirdly, the use of multiple modalities. So there are numerous various approaches we can use to help people who are experiencing mood disorders and anxiety. For some, lifestyle changes can be very helpful. Increasing physical activity, having regular sleep times, making dietary changes, avoiding alcohol. Each person needs to discover what works for them. There is unfortunately no uniform response to these changes. So some degree of self-monitoring as we alter each of these aspects of our lifestyle helps us get wiser and more effective in managing our mood. For some people, medication will be necessary. Some depressions have a very strong biological underpinning and they will not relent without medication. For other people, there'll be some symptom relief for using medication. And for some people, medication will not be helpful at all. So it's again going to be very much a personal journey of discovering what is helpful. I think what's important to say is if medication is necessary, it's not a failure or a sign of weakness and not being tough enough to beat the depression. It merely is a reflection of the type and severity of the depression that has necessitated the treatment with medication in a depression that would otherwise be insurmountable. There's a lot of misinformation around about the medications we use in mental health, so it's very important when making these decisions to also have a reputable place, a reputable source of information where you can get the facts and make good decisions for yourself. Thankfully these days we have quite a wide variety of treatments we can try, which means that if side effects are prohibitive or if someone is not getting a good result with one treatment, there are many others that we can try. Another modality is the talking therapies or psychological therapies. That might bring to mind lying on a couch telling a man with a beard about childhood. But actually these days, talking therapies are a lot about skill building. They're about learning skills and strategies that help recovery and prevent recurrence and relapse. Some of those will be quite practical, things like making sure each day you do an activity that's pleasant or pleasurable, and you do an activity that's rewarding, that's meaningful to you, and helping people schedule those so they happen on a daily basis. Some of the skills are more to do with the way we think, learning to outsmart the depression and anxiety. Depression talks non-stop. It says you're no good, it's too hard, there's no point. Anxiety says the worst possible thing is going to happen and you're not going to cope when it does. Depression convinces you to avoid the people who want to support you, to stop doing the things you love, to not bother with the things you normally enjoy and care about. And all of these things, if you listen to them, actually strengthen the depression. And most dangerously, depression can start to tell you that you're a burden to others, that you don't really belong anywhere, and that you're trapped and there's no way out. Psychological therapies like CBT, might be a word you've heard, cognitive behavioural therapy, or mindfulness-based therapies, they help people distinguish what is the black dog talking, yapping at your ear, and what is your authentic, wise self, and give you tools to challenge the black dog when it's yapping, or tools to distance yourself from it, so that it's a remote kind of bark in the distance rather than a loud bark right in your ear. The other thing about mental health care is it requires a team, and we'll have different members of the team here tonight, so that may be health professionals, it can be community groups, and it can be families and friends. And so making sure that we build a team when we're providing good mental health care is crucial. But your GP is probably the linchpin of seeking help, the first person to turn to. So what do we GPs do? I hope firstly that we listen well. So it's not just about getting you to fill in a questionnaire and then give you a diagnosis, but that we actually listen to what is happening for you. What are the stresses in your life? What is the context in which you find yourself? And really importantly, what are your strengths? What are the things that we're going to use to help you in recovery? GPs can also assist by creating a mental health treatment plan, and that will usually reflect that biological, psychological and social picture of your life as well as your strengths in a form which translates into a management plan. And that mental health treatment plan also allows you access to Medicare rebates for things like psychological services. GPs provide information and can also point you to other reliable sources of information, and can also provide you with referrals to other health professionals in the team. But most of all, we're home base. GPs are there for the long haul, sometimes for generations, through ups and downs, always looking for new options, new possibilities, new paths to try and take, or sometimes just being there with you through the most difficult times. I know for some of you here tonight, Dr. Mark was your home base, and you'd be feeling that loss most deeply. It's profoundly disorientating and distressing to be homeless. And that's where the strength of this community comes in, as evidenced by this wonderful turnout here this evening. By providing shelter for one another through this time of upheaval, creating a safe space, a place of compassion, of care and concern, where it's okay to be open and share the difficulties we face, where we're all equally strong but equally vulnerable, and we're all equally accepted and valued, regardless of where we are in our mental health journey.